Medical magical thinking. What do I mean? Medical magical thinking should not be occurring, but it does every day, all day long in practices. And it's just because doctors, they're not stupid. Doctors are smart. All my fellow physicians are really smart. I don't want to, I'm not going to make that mistake of falling in that trap of saying they're not smart. They are very smart, probably smarter than me. But medical magical thinking is a big problem. Think about it. You go in, you have low testosterone, you feel it, you have no libido, you're a guy, you're like, you don't even feel like having sex. Your wife is wondering what the heck is going on because you're tired all the time. You go in, and the doctor's like, you have low testosterone, let's put you on testosterone. Wait a second. He missed a major step in there. He should have said, you have low testosterone. Why do you have low testosterone? Or if he doesn't say it, you've got to ask for it. He doesn't know. It's magical thinking. And he doesn't know. He just thinks he gives you testosterone, the Band-Aid. We'll give you a Band-Aid. Why not deal with trying to find out why you have low testosterone? Or you have a low thyroid and you don't have a Hashimoto's or something like that. Why do you have low thyroid? Why is your thyroid gland not producing adequate amounts of thyroid? That needs to be delved into. Is it low selenium? Is it low iodine? What is it? I mean, it could be a number of different things. And if you have those, you're not going to make adequate amounts of thyroid. Or you're in POI, you have premature ovarian insufficiency or menopause early, whatever you want to call it. Same thing. Why your ovaries not working correctly? Someone needs to delve into that and ask. We do intracellular vitamin testing because that's what we used in Southern California at the university there. And we're doing pituitary endocrinology, cardiology research. I've written a number of best-selling books on all these subjects. You need to look them up on Amazon. You can find out more. We're now using a more advanced test than we were using a few years ago. It's highly more accurate, and it shows 3 times the amount of test results. It's a lot more sensitive too. We look for root causes. I don't know why doctors do magical thinking. I'm going to talk a couple of times actually, and both times it's to 5,000 physicians. It's a simple question I ask. What is insulin resistance? I literally can't get a straight answer. I mean, if you're a physician, put your answer now for what causes insulin resistance. Let's see it down there. Let's see if anyone can guess or figure it out. So insulin resistance is actually insulin receptor dysfunction. Let me explain that further. Your insulin receptors become dysfunctional for a number of reasons. And usually it's a vitamin deficiency, but it could be a low hormone problem. Testosterone is critical for insulin receptor function. But usually it's a vitamin deficiency that causes it. There are certain key vitamins that the insulin receptor needs to function. You need to think of the insulin receptor like a car motor or high-end sports model European car, and you have this insulin receptor that starts misfiring because it's missing either zinc or fish oil, DHA or EPA, mainly DHA. It's the oil for that engine. Chromium, B12, folate, other things that are so critical for insulin receptor function. And if you find those out, if you can discover those, remember, I'm looking at it more as a mechanical problem than a magical problem, because doctors will just treat you with metformin and tell you to start exercising more, which is true. You can exercise more. It does help. And maybe that's it. And they start you on metformin. Eventually that quits working. You have to go to insulin and other products and the high-end synthetic stuff that they're using now. So I believe that magical thinking is a fallacy thinking in medicine, that doctors need to look for root causes. So we look at that intracellular vitamin panel that we do, and we can get a pretty good idea why your insulin receptor is not working. It hasn't been too long a time, maybe only 2 or 3 or 4 years that you're type 2 diabetic. You can usually reverse it. If you find out why the insulin receptor is being dysfunctional, you can reverse it. There's a Reader's Digest article. There's been several on how they reverse type 2 diabetes. They don't delve into the way I'm delving into it, but people do it all the time. There's a lot of set things you can do to reverse your type 2 diabetes. If you have it, don't live with it. If you have low testosterone, look at the other options. Someone needs to look at your intracellular vitamins, minerals, amino acids. If you have PCOS, same thing. If you have POI, same thing. If you have POTS, same thing. If you have hypothyroidism that no one can figure out why, same thing. You can take medicines forever, or you can deal with the root cause And that's what I do. And I make a living doing this. I'm booked out 3 months. I'm proud of what I do, the hard work I do. I'm proud of my almost 700 5-star Google reviews. I don't do magical thinking. I look for root causes. I immediately dig in and go, we can figure this out. And because most of the people have gone to 14 or 15 doctors before they come to see me, and they've all kind of given them the same answer. For example, let's look at neuropathy in your feet. It could be from diabetes or whatever, trauma. If it's a nerve compression problem in your back, it's probably not going to be readily reversible, but any other causes, you can usually treat it. Really treat the root cause issues. It's usually a vitamin deficiency of some sort, or you've got some kind of toxin on your nerves. Those can all be reversed. Let me give you the treatments off of Google for peripheral neuropathy. Treatments include antidepressants like amitriptyline. Okay, that's treating the root cause. Not at all. Pain medications like oxycodone. That's definitely not treating the root cause. Anti-seizure medications, not sure why that. And pain relieving creams. But nowhere they talk about how to reverse it or how to treat it properly. So, isn't that interesting? We try and figure out what's going wrong, what's bad about it, what is the root cause of your neuropathy. We don't have magical thinking in our practice. So, magical thinking should be a no-no in modern medical practice. It clearly is a big yes. Most doctors do it. They're too busy. They're too crowded with patients. They're too overworked to spend the time to try and figure out what's going on with your weird neuropathy or low testosterone or PCOS or POI or hypothyroidism or all those problems that we see all the time. And that's what people pay me to do. It's so exciting to help people get off their meds and straighten their lives out and get rid of this horrible medical problem that they've had for years. Just hope this helps give you some more ideas on how you can deal with your neuropathy or other medical problems. This is Dr. Dan Purser. Thank you.